Mobile app innovation proposal. Psychological first aid. Staff assault by patients in mental health hospitals. My name is Jacinta Ugba, DNP 702, and I will be presenting on this topic. The provision of mental health services ranks among the most dangerous professions with a high occurrence of non-fatal workplace assault injuries. Most assaults occur between patients and staff. Injuries resulting from such assaults result in lost days of work, disability, psychological distress, and even death. Although the Occupational Safety and Health Act of 1970 mandates employers to provide employees a workplace free from recognized hazards that could cause injury or serious physical harm, thousands of assaults on mental health staff occur in many American psychiatric hospitals today.
You're watching Fox 25 News at 10.
Workplace violence at the state's premier psychiatric hospital is out of control.
Registered nurse Lori Grover is one of the faces behind the numbers. She was attacked by 2 patients at once earlier this year.
It was the worst beating I've ever taken in my life. You know, nobody else should have to do that. You know, it's not worth a paycheck.
Horror inside a Minnesota hospital, and it was all caught on camera. Officials say a 68-year-old patient attacked 8 nurses using a bar he pulled from the side of his hospital bed. This is the chilling surveillance video. It happened on Sunday, and what you can see is workers scrambling for cover as they realize what is going on.
The purpose of this video is to attempt to understand the reason for violence and aggression by psychiatric inpatients towards the staff, and to explain and evaluate the usability of the innovative mobile app that I have chosen that can help before, during, and after the crisis. According to Townsend and Angelo, approximately 1 in 5 adults in the United States experience mental illness. A substantial amount of research has been done on issues of mental health and aggression towards staff by patients. For this reason, choosing the mobile app that will help during crisis is very important. Therefore, I have chosen the Psychological First Aid mobile app for this. A survey conducted by the United States Department of Justice Crime Victimization from 1993 to 1999 indicated that the annual rate of non-critical job-related crimes was 12.6 per 1,000. The rate was 2.1 per 1,000 among physicians and 22 for registered nurses. However, for mental health professionals, including psychiatrists, the rate was 68.2 per 1,000 and 69 per 1,000 for mental health custodial workers. Studies also indicate that mental health staff experience a high rate of assault ranging from 10% to 35% and over 49.5% within 1 year period. Although it may be impossible to entirely eliminate staff assault in psychiatric hospitals, the number of staff assault may be reduced by identifying patient, staff, and environmental health risk. This innovation and collaboration go together, not either or proposition. In this project, I collaborated with psychiatrists, social workers, and IT personnel, and other floor staff. Psychiatrists today use one form of mobile app or another, and are often faced with the issue of confidentiality. Social workers interact daily with patients and family members, and their work is built mainly on human interaction. Therefore, I wanted to get their opinion on this mobile information technology in the workplace and how useful this app might be or may not be to them. Collaboration with the IT was essential because IT connects the main islands of information in the healthcare system and can both vastly improve quality and lower costs. It deals directly with the technicality and the cost involved and the potential problems relating to effective usability. Other staff also had their input on the benefits as well as challenges of the app. While use of this mobile app is plausible, there are also challenges. First, there is need for educating staff on how to use the app. There are many people involved in order to in order for the innovation to be successful, as mentioned earlier, and each with an agenda. Some of these, especially authorities, have the power and resources to influence general opinion. For example, it is not everyone that will agree with the use of this app. When I suggested this to my director, she immediately pointed out the high cost that may be associated with the implementation. She said that it is something to be considered, but not now. However, she agreed with it that it will be useful. This app includes basic information gathering techniques to help mental health specialists make rapid assessment of a crisis and the victim's immediate concerns and needs, and tailor interventions in a flexible manner. The PFA Phone app is available for Android and iPhones and iTunes, which is the world's easiest way to organize and add to a digital media collection. The PFA is very easy to use and benefit not only healthcare providers but all responders. The PFA app relies on field-tested evidence-informed strategies that can be provided in a variety of disaster settings, and then emphasizes developmentally and culturally appropriate interventions for survivors of various ages and backgrounds. The psychological first aid includes tools that provide important information for youth, adults, and families for their use over the course of recovery, contending with post-crisis reactions and adversities. Basic objectives of psychological first aid is to establish a human connection in a non-intrusive, compassionate manner, and enhance immediate and ongoing safety, and provide physical and emotional comfort. It also provides calm and orient emotionally overwhelmed or distraught victims and survivors. This app also serves as a connector to social support networks, including family members, friends, neighbors, and community helping resources, and healthcare providers. It supports positive coping, acknowledges coping efforts and strengths, and empowers survivors. It encourages adults, children, and families to take an active role in their safety and even recovery. PFA app facilitates continuity in disaster response efforts by clarifying how long the psychological first aid provider will be available, and when appropriate, linking the survivor to another member of a disaster response team or to indigenous recovery system, mental health services, public sector services. I also use other literature in this project. Other related literature were reviewed on the concept of violence, mental illness, the etiology of violence, and diagnosis associated with violence in psychiatric institutions. Literature review was done on precipitants of violence in the mental health settings, risk factors for violence, and evidence-based interventions that have been successful in reducing violence against staff. A lot has been done to alleviate the problem of staff assault, like the use of panic buttons, staff debriefing after a violent attack, the use of structured educational programs for nurses. But still, incidents of staff assault has been on the rise. This is where this innovative mobile app comes in. With this app, the staff and all users are informed on what to do pre-crisis, at time of crisis, and post-crisis. Other helpful books like The Medicine Effect, Innovator's Prescription, and many other articles were also useful and available, creating innovative ideas. I am convinced that with the information gathered, I can conveniently carry out my final project. The articles were chosen based on the relevance to the topic of violence in psychiatric patients and their relationships to staff. Each article touches on most of the keywords in this study and provide opportunities for intersectional collaboration. With this, I can build a good case for the use of my mobile app by combining these articles with the other articles on psychological first aid. The remaining articles provide descriptive statistics that are gathered for all variables on conflict and interrelationship between patients and staff. These articles will enable me to understand the life satisfaction of nurses following exposure to patients' violence in association with job stress and staff resilience. And here are my references. Thank you.